Most people have never heard of Apigenin, and if they have, it's just a compound in chamomile tea that helps you sleep. That's what it's sold for online almost all the time. They are missing the much bigger picture. Recent data suggests that while it puts your brain to sleep, it actually wakes up your immune system to help it recognize and reject cancer cells. But here's the catch. A cup of tea isn't remotely going to cut it. If you watched our video on aspirin and how to use it to prevent metastasis all the way through to the end, you've already heard about Apigenin. But there's a lot more to cover here. Beyond helping killer T cells work by blocking thromboxane A2, there are other ways that Apigenin helps anti-cancer immunity, and a couple of very large cautions. So please, stay with us till the end and make sure you've got the entire message, because it is something that you can implement quickly, easily, cheaply, and all by yourself. Hello, and welcome to Elevating Cancer Treatment, where we explain the science and debunk myths to help you navigate your health journey. My background is a little different. Beyond educating about cancer, I'm actually designing new drugs that are defining the future of oncology. This direct, hands-on experience offers me a very different perspective of how these cancer treatments work on the body, interact with the cancer cells, and cause side effects. And these are insights that I'm excited to share with you. If that sounds interesting, make sure to like this video, subscribe to the channel, and hit that notification bell so you never miss an update. And please share it if you find it useful. I'm Dr. Jay Chaplin. An important reminder, I'm a PhD, not an MD. The information in this video is education, and it's not medical advice. Every cancer is unique, and no general information applies to everyone. Please remember that. Always consult with your healthcare provider for guidance on your specific situation. And two quick things. First, as a thank you for being here, I've created a free resource, 10 Things to Elevate Your Chemo Journey, which you can download from the link below. And second, by signing up, you'll also get updates on that innovative cancer treatment I'm working on. I'm confident it represents a significant advancement in immunotherapy. So please take a moment, download your free guide, and join us in shaping the future of cancer treatment. So today we're looking at a flavonoid that does double duty, both reducing the stress that can fuel cancer and stripping away cancer's camouflage. So I have a question for you. Has your oncologist ever mentioned Apigenin to you? Not just you should get some good sleep or you should eat some veggies, but specifically using this compound for immune support. Let me know down in the comments below. In my experience, this is rarely discussed in the clinic, and I want to know if that's changing. So there are tons of articles on how Apigenin causes cancer cells to self-destruct, direct anti-cancer effects. And I'm sure most of those are actually true. Why? Because almost everything works on isolated cells cultured in the lab. Big deal. I don't get excited about those, neither should you. So this isn't really exciting for us because it's true, but it's not useful. As I've mentioned before, cells in a dish are a great start, but it's just not the same as providing benefit to the human body. Now, I put a bunch of those links down below just for completeness. If you want to see some speculative science that doesn't translate to people, go for it. As usual, the dose is the problem. We did an entire video on dosage and supplements. Almost all of the effects from those cell culture studies would need you to inject over 2 grams of Apigenin twice daily to achieve those same effects. Twice daily injections every day for months or years on end. As a result, I just don't count those studies. That's not something people should be considering, but there are very useful effects from much lower and more reasonable doses. Even at reasonable doses, Apigenin shows the ability to increase the efficacy of certain types of chemotherapy, particularly 5-fluorouracil. It just works better. And same with radiation treatments. They just work better. Anything you can do to get a bit more benefit out of the treatment you're already taking, when it doesn't make side effects worse, that's a significant bonus. I don't know why people wouldn't do that. Another benefit, and this one is huge, is protection against the heart issues that can come along with Doxorubicin. Doxorubicin is a very effective but very harsh chemotherapy drug, and the main issue we worry about is cardiotoxicity, heart damage. Reasonable doses of Apigenin have been shown in multiple studies, so this is confirmed, to reduce cardiotoxicity from Doxorubicin. And better yet, it does not impact the effectiveness of the treatment at all. That is a major, major win. If we're working together and you're on Doxo, just know I will be talking to you about Apigenin. You want to protect your heart. These are the kinds of things I always educate our clients on to make sure that they're supporting their treatment with anything that can improve their outcome. using relatively unappreciated options for their unique cancer treatment journey. That's what we specialize in. So for me, since my background is immune system function and regulation, I'm most excited about the data around how Apigenin unblocks anti-cancer immune responses in multiple different ways. It's always better to approach a problem from multiple different angles. Now again, in the aspirin video, we already talked about how it blocks the immunosuppressive hormone TXA2 throughout your body, and that lets you turn up the thermostat on killer T cell function. That, along with aspirin, really helps to prevent metastases. That's fantastic, and it's only the tip of the iceberg. So how does the rest of this work? Your immune system takes its regulation very seriously, and there are some tissues it knows that it should never attack, like your brain. So we know that cancer cells are very clever. They can adapt quickly, and many of them use a checkpoint signal. Think of it like a diplomatic immunity ID. The one we're talking about here is called PDL1. When your immune system's T cells come to the tumor to attack it, and they see that signal, not only do they not kill the tumor, they're forced to kill themselves. They don't just stop attacking, they're gone. And that is not what you want for cancer control. It's the opposite. It's a very good defense for the tumor and very bad for you. And this is where Apigenin becomes very useful. Research shows that it inhibits that PDL1 signal on the tumor. It essentially rips up the cancer's fake ID and it gives the green light to your immune system to attack the tumor, to do what it was designed to do, recognize the tumor as something's wrong here and reject it. Now, this is the exact same system that immune checkpoint inhibitors like Keytruda and Opdivo work on, and we did a whole video on immunotherapies. Is Apigenin as effective here as those are? No, not by a long shot. But it also doesn't require a prescription, doesn't require insurance authorization, doesn't require infusions, doesn't require a hospital visit. It is something that you can implement quickly, easily, cheaply, and all by yourself. Another way cancers hide is to produce immunosuppressive hormones like transforming growth factor beta, or TGF-beta. These drift out from the tumor and suppress immune function in the environment around it. Not only that, but TGF-beta turns other cells like macrophages and dendritic cells, which might normally play a role in attacking and controlling your tumor, it turns them into protectors instead. And they actually form a barrier that killer T cells and natural killer cells have a hard time getting through. Think of it as a smokescreen that actually turns people into zombies. Your enemy is co-opting your army and turning them into zombies to protect itself from you. This is not good. Now, Apigenin can't block TGF-beta from being made. The smokescreen is still there, but it does seem to block the actual signals from TGF-beta and keep it from functioning. And as a result, it reduces that protective shield around the tumor and keeps it from blocking the cancer from your immune system and keeping it safe. Therefore, your immune system can attack it and has a better chance of controlling it. Finally, there's a ton of buzz right now about a very nice mouse study treating pancreatic cancer using a cocktail of 3 different therapies. The results in that were amazingly good. They were really great, and I hope that they translate to human beings. It was 100% elimination of aggressive pancreatic cancer and 0 recurrence. That's great. The problem? Okay, you got 3 drugs. One of them has been approved and is out there. One of them is in clinical trials. Can't get it yet unless you're in a clinical trial. And the one that blocks STAT3 signaling, there are no compounds, not even in clinical trials for humans. They used a research compound with high toxicity for the mice. But guess what? Apigenin has been shown to inhibit STAT3 signaling. Turns it off. Now, no one has looked at immune cells, and it might be different there. We don't know. No one has bothered to look at that before. Until now, it hasn't been seen as very useful. But it has been shown in human tissue, so this may be a significant value add to those of you with pancreatic cancer. So to our pancreatic cancer clients, don't be surprised. I will be coming to recommend Apigenin to you. Now, I've got a cup of tea. Chamomile tea is great. It's soothing. It's a nice stress-relieving ritual. That has value in and of itself. But if we look at the studies that show that anti-tumor immunity effect, we have a big math problem. See, the effective range for those immune modulation effects, if you scale it up to human equivalent, it's 180 to 200 milligrams. That's a lot. Chamomile is rich in Apigenin, but it takes about 100 grams of chamomile to get an effective dose of Apigenin. Each tea bag has 1 maybe 2 grams of chamomile in it. That means you'd have to use more than 50 chamomile tea bags each and every day. So while tea is great, it's a nice habit for relaxation, if we're talking about actually elevating your cancer treatment, we're talking about supplementation to reach that biological trigger point, getting enough of a dose to actually have an effect. And you probably also have to take it with some fat to enhance absorption. And in some cases, you may want to take it less often, but in higher doses. I'll discuss that in a bit. Now, don't dismiss that sleep or stress relief benefit. This is a stacking opportunity as well. We know that cortisol, one of the primary stress hormones, suppresses the immune system. We did a whole video about stress and cancer. It's right here. By using Apigenin to improve sleep quality and reduce stress, you also lower cortisol, and, as we talked about before, you're using multiple different mechanisms to unmask the cancer for your immune system to attack it. When you attack any problem from multiple directions at once, you help prevent resistance from forming and you get better efficacy. This is always great. Now, here's the other problem with tea. There's a caution, I warned you about that, and here's a suggestion to go with it. Low doses of Apigenin have been shown repeatedly to act like estrogen or progesterone and mildly trigger those hormone receptors. That is not good for hormone receptor positive breast cancer. However, those effects have been repeatedly shown to be biphasic. What the heck does that mean, biphasic? It means that small amounts of Apigenin stimulate hormone receptors, but large amounts of Apigenin actually suppress the hormone receptors. It works backwards. This is why when we're discussing dosage with our clients, it's a critical conversation. It's not just take some, we gotta get this right. Because if you happen to have breast cancer and you're on an aromatase inhibitor like letrozole or exemestane, and you want to use Apigenin, it is much safer to switch your dosage around to a format that can't stimulate hormone receptors. In cases like that, it would make a lot more sense to pulse dosing with larger amounts, such as 600 milligrams of Apigenin every day, do that for a week, and then skip the next week. That way you have high and consistent doses for a good immune effect for the time that you're taking it, and you also give yourself breaks. Now, this is not the case if you're on a receptor degrader like fulvestrant or camizestrant. In those cases, you don't have to worry about receptor signaling at all because the receptors are just gone. They've been degraded, eliminated, and they can't signal no matter what you do. The details of your therapy matter. This is why we highly recommend that you bring this data to your oncologist. That's why we put everything down in the links below. Ask them, is Apigenin safe with my specific chemo protocol? Is it safe with my specific treatment regimen? And you can always reach out to us to find out about our cancer treatment optimization program and medical advocacy. Yes, we do talk with doctors. We work with clients and sometimes their doctors to provide guidance to help you navigate your treatment, your labs and reports, the side effects that can change and adapt over time, and make sure that you're making the right decisions for your treatment. They can be complex choices. You don't have to navigate them alone. You can move forward with clarity and support. Our link is down below in the description. Now, head on over to this video to see how Apigenin and aspirin work together to prevent metastases. It follows a very similar pathway of using common compounds for uncommon results. I'll see you over there. As always, if you found this breakdown helpful, please subscribe, comment, and share with folks who you feel would benefit from evidence-based cancer insights.